There's a longer version of these chapters on your learning platform, but I thought it would be good if I could summarize this in about 20 or 19 slides. That doesn't mean you should ignore the longer version that's on your learning platform, but this is a good place to start. This information is necessary for the registry as well as upcoming quizzes and other evaluations. So here are the four topics that we'll focus on: early versus late responses, lethal doses, dose response curves, and acute radiation syndrome, ARS. So you got a version of this slide in an earlier lecture, and this is just highlighting the differences between, or examples of, early tissue reactions and late tissue reactions, as well as stochastic effects. All right, so some key things here. Early tissue reactions and late reactions are called non-stochastic. The word stochastic means random, means something that can happen at any point. The example I like to use is if someone who's a smoker might never get cancer, and then someone who's exposed to secondhand smoke, they might get cancer. So we like to say that cancer is a random effect, right? The likelihood of getting cancer increases with the lifestyle, and or in this case, exposure to radiation. But cancer is a random effect, or we call that stochastic. Everything else is deterministic, meaning we know it can happen at a certain dose. We call it, so it's either stochastic or non-stochastic. And non-stochastic has a synonym in this context as deterministic. All right, so here are the examples of each of these. The most common stochastic or random effect is cancer. Now, you should know, and this is very key, that there is no safe dose for radiation. Some would say that you can get, so it's not accurate to tell a patient that if you get one x-ray, it's completely safe. What you can say is the likelihood of tissue damage is low with low amounts of radiation. You should know that the likelihood of damage, especially for stochastic effects, increases with dose. Another key difference here is deterministic effects, that is those that can be predicted. Those increase in severity with dose, but not so with stochastic effects, meaning you won't get worse cancer if you keep smoking, supposedly, right? So if you get cancer, that's why some people say, I'm going to keep smoking because I'm not going to get worse cancer. You can develop cancer somewhere else, but cancer is not going to get worse because you're smoking, right? It's already, the process has already been initiated. So in the case of radiation exposure, more exposure won't give you worse cancer. It'll give you different types of cancer, but the likelihood of stochastic effects, right, increase with exposure, not the severity. All right. So said another way, for stochastic effects, there is no link, at least as of today's literature, between exposure and the severity of stochastic effects. But there is a link between the exposure and the likelihood of the stochastic effect. All right. So somatic effects, soma, you learned this before, means body, right? So somatic effects are those that are experienced by the individual that has been exposed to radiation. Some examples of these are fatigue, nausea, erythema, which means skin redness, epilation, loss of hair, so on and so forth. That can happen within minutes or weeks after exposure. Now, just so you know, this is unlikely to happen with the type of radiation that we use, right? Very unlikely to happen. Dose response curve for early reactions. All right, so notice for early reactions, remember these are deterministic, there's a threshold, meaning it doesn't happen below a certain amount of exposure, right? So on one side you will see the absorbed dose, other one is severity on the y-axis, right? So that means the threshold just means it does not happen until a certain amount of dose has been delivered or absorbed by the patient. Acute radiation syndrome, again, these will not happen in the diagnostic range. For example, a typical chest x-ray, you'll have absorbed dose of 0.0001 gray, something like that, some small amounts, right? But between 1 and 10 gray, you can have hematopoietic. That means decreased number of blood cells, blood marrow damage. Uh, Greater than 6 gray, you can have gastrointestinal symptoms such as nausea, intestinal damage, appetite loss, anemia, diarrhea, and so on. Death may occur in as little as 3 days. And the most severe of these would be cerebrovascular. So anybody who receives greater than 50 gray will experience cerebrovascular acute radiation syndrome. And death can occur within a few hours. So you might ask yourselves, who might experience this? That'll be nuclear bomb, people who are exposed to nuclear energy from Chernobyl or Nagasaki or Hiroshima, that kind of stuff, right? So what are the stages of acute radiation syndrome? The prodromal stage is the initial onset of symptoms, right? The latent is a false calm. So the symptoms temporarily go away. Seems like everything's fine. And then manifest stage, when they come back with a vengeance, they get really terrible. And then the last stage, I don't know if you want to call it a stage, but it just means, will the person survive or not? Right. So again, there are 4 stages. The prodromal, which is when the symptoms initially appear. The latent stage is a false calm, so things kind of seem like they're okay, but it's not really. And then the manifest stage is when they come back with a vengeance. Lethal dose. When you see this term, and this is still on the registry, by the way, lethal dose 50-30. This is pretty easy to understand. A lethal dose 50-30 means the amount of dose that will kill 50% of the population. Let me get my little laser. 50% of the population in 30 days. So the first number is the percent of the population. The next one is how many days. So from that you can, let me erase all this. From that you can infer what the rest of these mean. So LD 10, 30, LD 50. Let me go back. LD 50, 60, LD 100, 60. So try to figure out what that means. The answers are in the I think I'll try to put the answers in the bottom, but I'll give you one of them. So LD 160 just means the amount of dose that will kill everybody in 60 days, right? So if you're looking at this chart, and so let me see if I can come up with a typical question. A typical question would be, what's the dose that will kill 50% of or the dose at which 50% of the population will die, right? So we will say, so this is LD 50-30 for adults. What's the dose that will kill 50% in 30 days? So we can then get a little pen. We can then just draw a line right across here and draw that down towards, see where that meets the x-axis, and that will be a dose that will kill 50% of the population within 30 days. Then you would say, what's the dose that will kill 75%, right, in 30 days, right? That would be, you just draw a line right across. See where that comes down. Kind of like that, all right? Let me erase all this. All right, so the layers of the skin, we talked about this earlier, or you were introduced to this earlier, where we spoke about the law of Burgondian tribundio. And so this touched on that younger cells are more susceptible than older cells. It also mentioned that undifferentiated cells are more susceptible to radiation than differentiated cells. And the other part of this, or the other leg of this, would be cells that are rapidly dividing are more susceptible to radiation damage than those that are not rapidly dividing, right? So the way how I like to summarize this is younger cells, stem cells, and cells that are rapidly dividing are more susceptible to radiation than their opposite counterparts, right? So you can rewind this and pause it, and see how you can want to write that down for yourself, how you can want to internalize that. So we can look at the layers of the skin here. See if I can pause this. You can look at the layers of the skin, and we can see that the basal layer that's blown up here. This is a bit, or the layer that is rapidly dividing. And as you go from deep to superficial, then the the rate of division slows incrementally, right? So the basal layer is the layer that is most susceptible to radiation. And the top layer, which is the layer of dead skin, is radio resistant. So again, typical register review question would be, which layer of the skin or which layer of the epidermis would be more susceptible to radiation damage? That would be the basal layer. Why? Because it's more rapidly dividing, or most rapidly dividing of the epidermal layers. Now let's talk about the late effects. That will be those that occur after some time, right? So it won't happen in a couple of hours, maybe not even days, could be weeks or months. So to understand that, we should know about digging a little bit more about dose response curves. So on one axis we have the dose received, and the other axis we have the response to radiation. Now remember, this is observed effects, right? There are two things you should know about this. The straight line, well, these can be described in a variety of ways. We typically have four descriptors. One is it a linear curve? I know it sounds a little like an oxymoron, a linear curve, right? But this is how the scientists have described this. A linear curve, it's more like a straight line. A non-linear curve, well, it's not a straight line, as linear is a derivative of the word line, right? A threshold curve is one that does not start at zero, meaning if the effect is observed after a certain amount of dose has been received. So that we can marry these up together, all right? We can have linear non-threshold, that's this one. We can have linear threshold, that's this red one. We can have non-linear threshold, that's this one. Obviously, we can have non-linear non-threshold, not shown on here, but let me draw it. So non-linear non-threshold would be a curve that starts right at zero. Now, non-threshold response is one that is observed at the very first exposure, right? Linear or non-linear threshold curve is only observed after a certain amount of dose has been received. All right, so just to recap, we look at these. We can look at these and describe them in two of four ways. We usually pair them up together. A linear curve is one that resembles a straight line. So what does that mean? That means that the observed response is directly proportional to the amount of dose received. So it goes up. More dose, more response. So if it's skin redness, the skin gets redder as the amount of exposure increases. A non-linear curve, it isn't always directly proportional. So you could see a little plateau here where nothing happens, right? So some part is proportional, sometimes it's not directly proportional, it's related, right? A linear threshold curve, there is a direct proportional relationship between response and dose received, but it's only observed after a certain amount of dose has been absorbed. Right? So those are the four descriptors we use for dose response relationships. And here they are in one slide for you to look at. All right, so let's look at these, a couple of these one by one, right? So here we can see this one, a linear threshold curve radiation dose is typically used for those deterministic, and if you can recall, the other name for deterministic response would be non-stochastic, right? So deterministic just means that we can predict it's going to happen. So skin erythema will not happen after one exposure on your hand. But if you keep doing a whole heap of exposures on your hand consecutively, you can expect some kind of skin redness, probably hair loss. And this happens with people who have or undergoing radiation therapy, right? They will sometimes lose their hair, that kind of stuff, in the area, and they will have redness of the skin, right? A linear non-threshold, those are the things that we see immediately after the first exposure. Unlikely to happen in the diagnostic range, but it can happen in high exposures to the body. All right, some key takeaways here would be that if there's a non-lethal exposure, then the cell will repair itself. So in radiation therapy, for example, they have what's called, and this is outside the scope of this, but it's cool to know, they have what's called fractionated dose. So they will give, let's say the patient needs or is prescribed by the physicist or the radiation therapist or the doctor to receive, let's say, 5 grays, and they assume that's going to be what's necessary to destroy the cancer. What they do is they break that up. So instead of giving 5 grays at one time, which will elicit some kind of acute radiation response, they break it up into smaller increments. And what that does, it gives the healthy tissue time to heal. So if the non-lethal dose is absorbed by the patient or the tissue, then the tissue has time to repair and heal, and hopefully only the cancerous tissue will die. That's in the case of radiation therapy. Again, this is not something that we use in radiography or medical imaging. However, it is one of the considerations. So for example, quite often we would look, if someone is ordered for a CAT scan, which is a significant higher dose than X-ray, one of the considerations what we would use to proceed is, when was the last CAT scan, and is it necessary? And it is your job actually to determine this. You are the purveyor of radiation exposure, so you have to go and ask the doctor. The patient just had this examination. What is there something else we're looking for? Obviously, you're going to do it in a respectful manner, but you have to look at the chart to see, is this necessary? When was the last one? What are we trying to learn from this new exposure? And that just means we don't want to expose the patient consistently unnecessarily. Again, we use low amounts of radiation now in medical imaging, but there's still a risk of damage. All right, so let's see if we can figure out some of this stuff, right? So line A, I didn't ask you, actually it wasn't on the other one, but I'm gonna ask you if you could figure this out. So line B, we pretty much know what that is, right? That's a linear non-threshold. Line C, that's a linear threshold. It doesn't start at 0. Line D is a non-linear threshold. Also doesn't start immediately, but it's not always proportional to exposure, right? The response observed is not always proportional to exposure. Well, what about line A? What do you guys think line A is? You can pause this to see if you can take a good guess. And so hopefully you've figured it out. Line A, this response was already present. It was already present before the exposure. So it's still a linear non-threshold, but the response was already present. Remember this, on the y-axis we have response. So the response is already high, and the exposure just makes it worse. We're going to try to draw a non-linear non-threshold. I'll pause this to see if you could figure it out, and I'll slowly go over here with my pen. So we're trying to draw this one, non-linear non-threshold. So first it's going to be a curve, non-linear non-threshold. Non-linear non-threshold, meaning it starts at 0. So if you remember, I drew this on the prior slide actually. All right, so then let's then talk about cancer. Which one of these represents cancer? And most people, most scientists have agreed that the risk of leukemia and breast cancer and genetic effects, which are all stochastic or random effects, is best represented by a linear quadratic non-threshold curve, meaning it can start at any point, start at 0 with the first exposure, right? Linear quadratic non-threshold. That's the one that typically represents those types of cancers. All right, so genetic effects, which is the other type of stochastic radiation response, that would be those that are passed on to offspring. So you might get an exposure, a gonadal exposure, and you don't experience it. So it's not a somatic effect, but you pass on this damage to the offspring. Well, how does that happen? So earlier we learned about, or in a previous class we learned about DNA, and we learned about how the DNA is the critical part of the cell, and how DNA codes for different traits and so on and so forth, and different proteins. Right now, and we have the nitrogenous bases where if they're out of order, then we can have miscoding, or we can have tissue that's growing out of order, not in a way that it should grow. Right? So if one of these bases are destroyed or knocked off, or even the rungs of the DNA are damaged, we can have genetic effects of radiation. Right? So you don't observe it, but in the child will develop these kinds of effects. Again, genetic effects are different from somatic effects because somatic effects are experienced by the individual that's been exposed. Genetic effects are those that are passed on to offspring. All right, teratogenic effects are those that happens when the fetus is irradiated. Right, so consider the mom with child, and the fetus is irradiated in the womb. Then the child can develop these effects, and we call these teratogenic effects. Right, so the most susceptible period of gestation is the first trimester. It's the first 3 months. Right? And you can have all kinds of problems. You can have infant mortality, childhood malignancy, or congenital malformations, decreased birth weight, and all kinds of stuff can happen. So we try to limit the exposure to radiation to the mom. Now, for routine X-rays, if it's not an emergent situation, they probably won't even do it. If it's a hand X-ray with proper shielding, the child and mom will probably be fine. If the mom is having severe chest pains and they're trying to figure out if she has a pulmonary embolism, one of the tests that they would likely do would be either a nuclear medicine scan or a CT scan. Now, in those situations which we consider emergency, they do not wait. They go ahead and do it, and they then consider that the benefits outweigh the risks. All right. So important dose limits would be that you should know about. We're going to talk about this later on, and you're going to learn about this again in another class, radiation biology. But some important dose limits you should know about is 2 gray absorbed dose can cause skin erythema within 24 to 48 hours. And 0.1 gray of gonadal dose can cause decreased sperm count or delayed menstruation. All right, so that is the end of this short description. Again, be sure to read the chapter, look at the PowerPoint in its entirety, and I'll try to put some activities up so you can practice before you get back to class. All right, take it easy.